Introduce yourself and explain the procedure. Clearly tell the patient who you are and what you are going to do. Explain why they are receiving a bed bath and ask if they have any preferences or concerns. Adjust bed height. Raise the bed to a comfortable working height to prevent back strain for yourself. Lower the side rail on the side you are working on. Provide privacy. Close the door, draw curtains, or use a privacy screen to ensure the patient's privacy. Remove top linens. Loosen and remove the top sheet and blanket, leaving a bath blanket or clean sheet over the patient for warmth and privacy. Place soiled linens in the laundry hamper. Perform hand hygiene. Wash your hands thoroughly with soap and water or use an alcohol-based hand sanitizer. Put on clean gloves. Start with the face. Place a towel under the patient's head. Wet a washcloth with plain warm water, no soap for the eyes. Wipe each eye from the inner to the outer can, thus using a different part of the washcloth for each eye. Wash the rest of the face, ears, and neck with a small amount of soap, then rinse and pack dry. Move to the arms. Place a towel lengthwise under one arm. Wash the arm, starting from the shoulder down to the fingertips, using long, firm strokes. Pay attention to the axilla, armpit. Rinse thoroughly and pat dry. Repeat for the other arm. Wash the chest and abdomen. Fold the bath blanket down to expose the chest and abdomen. Wash the chest and then the abdomen, paying attention to skin folds. G. Under breasts. Rinse thoroughly and pat dry. Recover the area with the bath blanket. Wash the legs. Expose one leg by folding back the bath blanket. Place a towel lengthwise under the leg. Wash the leg from the thigh down to the ankle. Rinse thoroughly and pat dry. Repeat for the other leg. Wash the feet. Place a basin of warm water on the bed with a towel underneath and gently place the patient's foot into it if possible. If not, use a washcloth. Wash the foot, paying attention to the toes in between them. Rinse thoroughly and pat dry, especially between the toes to prevent fungal growth. Repeat for the other foot. Wash the back. Assist the patient to turn onto their side, facing away from you. Ensure they are stable and safe. Place a towel along the patient's back. Wash the back from the neck down to the buttocks, using long, firm strokes. Pay attention to the gluteal fold. Rinse thoroughly and pat dry. Gently rub the patient's back with lotion if desired, and if there are no contraindications. This can be soothing and help with circulation. Help the patient roll back to a supine position. Perform perineal care. Change the water in the basin and use a fresh washcloth. Ensure comfort and safety. Lower the bed to its lowest position. Raise the side rails as appropriate for the patient's safety. Place the call light within the patient's reach. Ask the patient if they are comfortable and if they need anything else.